Hello everyone and welcome back to my channel. I'm Dr. Rose Khavari. Last week, a longtime patient of mine, a wonderful gentleman named John in his early 70s, came to see me. He sat down, looked at me, and said rather hesitantly, "Dr. Rose, I feel like I'm losing a part of myself." He wasn't talking about his joint pain or his blood pressure. He was talking about something much more private. He shared that he and his wife have been through more than 50 years of life together, and intimacy has always been the bond that held them close. But for the past few years, his body just doesn't seem to listen anymore. He had tried the famous blue pill, but it gave him headaches and a worrisome racing heart. Even worse, he said it made those intimate moments feel mechanical, more like a chore than a natural connection. He told me, "I don't want to depend on a pill to feel like a man, to feel like a husband." I believe John's story is not unique. I know that so many gentlemen out there are quietly going through the same thing. A sense of embarrassment, frustration, and maybe even a little fear that their vitality and manhood are fading with time. Today we are going to talk about this topic openly, honestly, and with a great deal of hope. We're going to explore how to overcome erectile dysfunction without needing the blue pill. In today's episode, we're not just going to talk about the mechanics. We're going to go deeper than that. We will learn how to rebuild your health from the inside out so your body can function at its most natural and strongest. My goal isn't to offer a magical overnight fix. It's to walk with you down a sustainable path, a lifestyle that improves not just your sexual health but your energy, your spirit, and your overall quality of life. Because sexual health isn't a separate issue, it's a mirror reflecting our total well-being. So let's begin this journey together. The first and most important thing I want you to understand is this erectile dysfunction, or ED, is not a mandatory consequence of getting older. Yes, our bodies change, but seeing it as something you just have to accept is one of the biggest and most disempowering misconceptions. Let's stick with that analogy of your body being like a house. For a healthy erection to happen, you need two systems to work in perfect harmony: the plumbing, that's your blood flow, and the electrical, your nerve signals. Let's talk about the plumbing first. An erection is fundamentally about blood flow. The brain sends a signal, the blood vessels relax and open wide, and blood rushes in and stays there. Now, after 60, many of us are dealing with conditions that directly damage this plumbing. High blood pressure, for instance, is like running water through your pipes at a pressure that's way too high for years on end. Over time, this damages the delicate inner lining of your arteries, making them stiff, scarred, and less flexible. They can't open up as wide as they need to. Diabetes with high blood sugar makes the blood itself thicker and stickier, and it directly damages both the small blood vessels and the nerves. Think of it as pouring syrup into your plumbing system. It just doesn't flow well. High cholesterol leads to plaque buildup, which is like sludge or rust accumulating on the inside of your pipes, narrowing the passageway. This is why I always tell my patients, what's good for your heart is good for your erections. The arteries in your heart are larger. The ones in the penis are tiny, like little capillaries. So if there's a system-wide problem with your plumbing, where do you think you'll see the first signs of a blockage? In the smallest pipes. That's why you should view ED not as a failure, but as a messenger. It's the canary in the coal mine, an incredibly valuable early warning sign that your cardiovascular system needs attention. It's your body giving you a heads up, a gift of time to make changes before a more serious event like a heart attack or stroke occurs. Now let's talk about the electrical system, the mind and nerves. Your brain is the master control center. It's what initiates the whole process by sending a relax and allow blood flow signal. But what happens when the control center is preoccupied with stress? Stress, anxiety, and depression flood your system with hormones like cortisol and adrenaline. These are fight or flight hormones. They are designed to do the exact opposite of what's needed for an erection. They constrict blood vessels to send blood to your major muscles so you can run from a threat. This creates a truly vicious cycle. You might have one disappointing experience. The next time, the memory of that experience creates anxiety. That anxiety itself releases hormones that prevent an erection, which then confirms your fear. The fear becomes a self-fulfilling prophecy. Your mind, in trying to protect you from embarrassment, inadvertently creates the very situation you're afraid of. So, the first step is a mental one. Let's reframe this. Let go of the thought, I'm old and broken. Instead, embrace this thought. My body is communicating with me. It's sending a signal. It's time to listen, to open the blueprint of my house, and to start lovingly repairing both the plumbing and the wiring. So, how do we begin these repairs? This is the hopeful and empowering part. It's about building 4 strong pillars that will support not just this one aspect of your health, but your entire life. Pillar 1: nutrition for your vessels. I said before that the Mediterranean diet is a great model, and it is. But let's break down the why. The magic word here is nitric oxide. Think of nitric oxide as a tiny signaling molecule. It's the message that tells the smooth muscle cells in your artery walls to relax. When they relax, the artery opens wide like a 4-lane highway instead of a narrow country lane, allowing blood to flow freely. Many of the foods we eat can either help or hinder our body's ability to produce this wonderful molecule. Nitrate-rich powerhouses. Your body converts dietary nitrates into nitric oxide. Where do you find them? Leafy greens are the champions. Think spinach, arugula, kale, and lettuce. Beets and beet juice are also famously effective. Just adding a large salad to your lunch every day can make a significant difference. Amino acid boosters. An amino acid called L-citrulline, which your body also converts to nitric oxide, is found in high amounts in watermelon. Other sources include cucumbers, nuts, and legumes. Flavonoids for protection. These are antioxidants found in colorful fruits and vegetables. Berries, blueberries, strawberries, citrus fruits, oranges, lemons, and even dark chocolate in moderation are packed with flavonoids. They act like a protective shield for your blood vessels, preventing damage and reducing inflammation. Healthy fats are your friends. Not all fat is bad. The plaque that clogs arteries is often caused by inflammation and unhealthy fats. Omega-3 fatty acids found in salmon, mackerel, sardines, and flax seeds are powerfully anti-inflammatory. Monounsaturated fats from olive oil, avocados, and almonds help lower bad cholesterol and keep arteries flexible. What to reduce? The artery cloggers. Think of sugar, refined white flour, and processed foods as rust promoters. They increase inflammation and damage the delicate lining of your blood vessels. When you eat a donut or a bag of chips, visualize that sludge building up in your pipes. Hydration is key. Don't forget water. Your blood is mostly water. When you're dehydrated, your blood becomes thicker and more viscous, making it harder for your heart to pump it through narrow vessels. Aim for 6 to 8 glasses of plain water a day. A sample idea. Start your day with oatmeal with walnuts and berries. For lunch, have a large spinach salad with grilled chicken and a light olive oil vinaigrette. For dinner, enjoy a piece of baked salmon with roasted broccoli and a small sweet potato. It's not about deprivation, it's about adding in the good stuff. Pillar 2: movement is medicine. Movement improves blood flow, produces nitric oxide, reduces stress, and helps control weight, blood pressure, and blood sugar. It's a miracle drug with no bad side effects. Cardio is non-negotiable. That 30-minute brisk walk is your foundation. But what does brisk mean? It means you can still talk, but you couldn't easily sing a song. Other great options are swimming, cycling, or using an elliptical machine. All are low impact on your joints. Consistency is far more important than intensity. 5 30-minute walks a week is better than one grueling 2-hour session on the weekend. Kegel exercises for men. A step-by-step guide. This is your targeted exercise. Strong pelvic floor muscles press on a key vein at the base of the penis, preventing blood from leaving during an erection. It's the difference between a tire that holds air and one with a slow leak. Step 1. Find the right muscles. The next time you are urinating, try to stop the flow midstream. The muscles you use to do that are your pelvic floor muscles. The PC muscles, that's the feeling you're looking for. Important. Do not make a habit of doing this while urinating, as it can be bad for your bladder. Use this only to identify the muscles. Step 2. The squeeze. Now that you know the feeling, you can do the exercise anytime, anywhere. Sit or lie down comfortably. Take a breath, and as you exhale gently, squeeze those muscles. Imagine you are lifting your pelvic floor up and in. Step 3. Hold and relax. Hold the squeeze for a count of 5 seconds. Make sure you are not squeezing your buttocks, thighs, or stomach muscles, and most importantly, do not hold your breath. Breathe normally. After 5 seconds, relax completely for a count of 5 seconds. The relaxation phase is just as important as the squeeze. Step 4. Repetitions and habit. Aim for a set of 10-15 repetitions. Try to do 2 to 3 sets throughout the day. You can do them while you're stopped at a red light watching the news or brushing your teeth. No one will know you're doing them. It takes time to build muscle, so be patient. You might start noticing a difference in a few weeks or a couple of months. Consider Tai Chi. This ancient practice is often called meditation in motion. The slow, deliberate flowing movements are excellent for improving circulation balance and flexibility without stressing the joints. Furthermore, it's a powerful tool for reducing stress and connecting your mind with your body, directly addressing the psychological component we talked about. Pillar 3. The power of sleep and stillness. You cannot cheat on sleep and expect your body to perform well. Sleep is when your body does its most critical repair work. It's when you produce growth hormone and a significant portion of your daily testosterone. Master your sleep hygiene. This means creating a routine and an environment that signals to your brain that it's time for restorative rest. Be consistent. Go to bed and wake up around the same time every day, even on weekends. Create a cave. Your bedroom should be dark, quiet, and cool. Use blackout curtains, earplugs, or a white noise machine if needed. Power down. Turn off all screens. TVs, computers, phones at least an hour before bed. The blue light they emit tricks your brain into thinking it's still daytime. Avoid stimulants. Skip that late afternoon coffee and avoid alcohol close to bedtime. While alcohol might make you feel drowsy initially, it disrupts the quality of your sleep later in the night. Practice active stillness. This is more than just sitting quietly. It's about actively calming your nervous system. Let's try that simple breathing exercise again, but as a mini meditation. Find a comfortable seat. Close your eyes. Just take a moment to feel the chair supporting you. Feel your feet on the floor. Now bring your attention to your breath, just noticing it for a moment. Now let's guide it. We'll do a box breath. Inhale gently through your nose for a count of 4. 1, 2, 3, 4. Now hold that breath gently at the top for a count of 4. 1, 2, 3, 4. Now exhale slowly and completely through your mouth for a count of 6. 1, 2, 3, 4, 5, 6. Feel the tension leaving your shoulders. Let's do that 2 more times. Guiding yourself like this for just 5 minutes a day can literally rewire your brain's response to stress. Pillar 4. The strength of connection. This may be the most powerful pillar of all. Secrecy and shame are fuel for anxiety. Connection and vulnerability are the antidote. Start the conversation. This is the hardest step for many men. You don't have to have all the answers. You just have to be brave enough to start. Find a quiet, calm moment. It's not a conversation for the bedroom. Maybe it's over coffee in the morning. Try a gentle opener like, "Honey, there's something that's been on my mind and it's been making me feel a bit distant. I'd love to talk about it with you. I've been struggling with some changes in my body lately, and honestly, it's been affecting my confidence. I want us to be a team on this. I miss our intimacy, and I want to find our way back to it together, even if it looks a little different." Sharing this takes the burden off your shoulders. It makes it our challenge, not just my problem. Redefine intimacy creatively. For so long, we've been conditioned to think intimacy equals one specific act. But that's like saying a beautiful meal is only about the main course. Intimacy is the entire feast. It's the appetizer, the conversation, the dessert. It's A long, lingering hug for no reason. Holding hands while you watch a movie. Giving your partner a shoulder rub or a foot massage without expecting anything in return. Sharing a slow dance in the living room to your favorite old song. Leaving a little note for her to find. When you take the pressure of performance off the table and focus on these other ways of connecting, something amazing happens. You both relax, and in that state of relaxed, loving connection, the body is often much more willing to cooperate. I want to return to John's story. When he started his journey, he didn't just go for a walk. He told me he started to notice the feeling of the morning sun on his face. He didn't just eat better. He and his wife started cooking together, enjoying the taste of fresh food again. His transformation wasn't just physical, it was a shift in his whole approach to life. His focus moved from what's not working to what can I do to feel good today? And the physical improvements followed that mental shift. His story shows that change is possible, but I also want to take a moment to warn you about some common and dangerous myths that prey on men who are feeling vulnerable. Myth number 1, the all-natural herbal miracle cure. You see the ads online or in the back of magazines. They promise a Viagra-like effect from a secret or ancient herbal blend. Please be extremely cautious. The supplement industry is largely unregulated. Many of these products have been tested and found to contain nothing useful at all. Worse, some have been found to contain hidden, unlisted ingredients, including actual prescription drug powders like Viagra or Cialis, but in unpredictable and unsafe doses. Mixing these with certain heart medications can be fatal. There is no magic pill in a bottle. The magic is in your daily lifestyle choices. Myth number 2, I just need a testosterone shot. As a urologist, I manage testosterone levels for men every day. And yes, it is important, but it is very rarely the primary cause of ED, especially when blood flow issues are present. Testosterone is like the desire switch, the ignition for the engine. But if the fuel lines, your blood vessels, are clogged, turning the key harder won't start the car. We must fix the fuel lines first. We always address lifestyle and cardiovascular health before, or at least at the same time, as considering hormone therapy. Myth number 3, this is a standalone problem. We've touched on this, but it bears repeating. This is perhaps the biggest myth. ED is almost never a problem in isolation. Think of it as the check engine light on your car's dashboard. You don't fix the problem by putting a piece of tape over the light. You thank the light for the warning, and you open the hood to see what's really going on with the engine. So where do we go from here? Let's bring it all together. First, we've reframed the problem. Erectile dysfunction is not a personal failure or an inevitable part of aging. It is a health signal, a valuable messenger primarily about the health of your cardiovascular system and your state of mind. Second, we've laid out a clear, hopeful, and powerful blueprint for change built on 4 pillars. Nourishing your body with foods that clean and protect your blood vessels. Moving your body to improve circulation and reduce stress. Restoring your body with quality sleep and moments of stillness. Connecting with your partner to remove pressure and rebuild intimacy. And finally, we've learned that this is a journey of self-care, not a performance test. The goal is to feel healthier, more energetic, and more connected overall. The improvements in your sexual health will be a natural and wonderful result of that process. When you tend to the health of the entire garden, the flowers bloom on their own. I truly hope that our deep dive today has left you feeling empowered, not overwhelmed. Remember that you hold the power to make these positive changes. Start small. You don't have to overhaul your entire life tomorrow. Maybe tomorrow you just go for that 15-minute walk. Maybe you just add a glass of water instead of a soda. Maybe you just take 5 deep breaths before you get out of bed. Every single small step you take is a huge victory for your long-term health. Thank you so much for spending this time with me. If you found this conversation valuable, please show your support by clicking the like and subscribe buttons. It helps this message reach other men who might need to hear it. And please feel free to share this video. You never know who in your life might be struggling in silence. An open, hopeful conversation can be the first, most important step toward healing. I'm Dr. Rose Khavari, wishing you a week filled with vitality, good health, and deep, meaningful connections. Be kind to yourselves and take good care. Goodbye for now.